everyone. Welcome to Stop HIV, that's Screen, Treat, Overcome, Prevent HIV, Engaging Convenient Care. Today we're going to review our Meet the Patient session. This program is jointly provided by the Postgraduate Institute for Medicine and DKB Med for a maximum of 1 AMA PRA Category 1 credits. The faculty for this session is Justin Alves, EHIV Review Program Director and Clinical Nurse Educator in Boston, Massachusetts. Justin has no financial relationships to disclose and has not indicated that there will be references to unlabeled, unapproved uses of any drugs or products. This activity is made possible through an educational grant provided by Gilead Sciences Incorporated. All activity content and materials have been developed solely by the planning committee members and faculty presenters. Our learning objectives for this program are to assess eligibility for pre-exposure prophylaxis, PrEP, among patients seen at your convenient care practice, and to describe the benefits of rapid initiation of antiretroviral therapy, ART, for people with newly diagnosed HIV in the convenient care setting. Thank you for your attention, and now I'll turn it over to Justin.
Thanks for the introduction, Ashley. And now let's look at some patient scenarios, really incorporating the information we provided you in those other two sessions about PrEP and HIV starts. Okay, so let's take a look at one patient scenario with Brandon. Brandon Carter has come to your clinic because of dysuria and urethral discharge. He's not nervous about the symptoms, but when you start to question him, he starts to get a little anxious when you're sort of getting into his sex life stuff. So this is pretty common. Let's see how one of your colleagues sort of dealt with this in her interview and what she decided to do next.
Hi, Brandon. How are you today?
Hi, I'm okay.
Hi,
I'm a little worried about.
My name is Deborah. You're a little worried. Tell me a little bit. What's going on? What worries you today?
Okay, nice to meet you, Deborah, by the way.
Nice meeting you.
For the past week, I've noticed that it hurts when I urinate.
Mm-hmm.
And that's what's been happening so far.
Okay. Are you having like any fever, any back pain, or?
No, thank God. The only thing I've really had is just pain when I urinate or ejaculate. Those are the only two issues I've been having.
Okay.
Nothing else really.
Okay. There's do I have permission that we can discuss your sexual health? And the reason why I'm asking permission is to identify or try to identify what is causing you symptoms. Because your symptoms could be caused by you have a urinary tract infection or possibly because you have a sexually transmitted infection.
Okay. I appreciate you telling me that. I am knowing that and the reason why I feel comfortable.
Okay. Now, have you ever had a sexually transmitted infection in the past?
No, I have not.
Okay. And are you sexually active?
Yes.
Okay. And when's the last time you had a sexual encounter? 2 months ago, 3 months ago?
About a week and a half ago, I had sex with someone.
Okay.
That's
Okay. So about a week and a half ago.
yes.
And what is your gender preference as far as sexual encounter?
As far as sex goes, I've only had sex with men as of now.
Okay. Okay. All right. And are you in a monogamous relationship or?
No, not in the last 2 years. Before that, I was in a relationship with a woman for a long time.
Okay.
But we broke up about 2 years ago, and since then, I've been having sex with men, and I have not been in a relationship since then. So I'm just
Okay. All right. So with that information, there's some testing that we can do. We can try test you for sexually transmitted infection, and the most common ones are gonorrhea, chlamydia, trichomonas, syphilis.
Sounds about right. Okay.
HIV, and also we will also check to see if you would be infected with hepatitis B or hepatitis.
Okay.
And we're going to get some So when you are sexually active, or are you having vaginal, I'm sorry, you have, or yeah, are you having vaginal, anal, oral, what type of?
Just to clarify, I've only had sex with men, so vaginal wouldn't be.
Okay, yeah.
But
When I, yes,
I
okay,
appreciate you
perfect.
asking still.
Yeah.
But no, I've had anal and oral, yes.
Okay,
Yes.
okay. So what we would actually, I would get a swab, an oral swab to test for chlamydia, gonorrhea, and
Understood.
trichomoniasis. And also we would do a rectal swab, and we would get urine. So then I would send it out to the lab.
Okay.
And because I'm sorry, Brandon.
It's
How
okay.
old are you? How old are you?
I am 24 years old.
Okay. Because we have some guidelines if you're 40 and older. Not that you look 40 at all, but we have some guidelines. 40 and older,
Thank
our
God.
clinic. If we would send you out, but
Okay.
we would I would get the lab work today. Yeah, I can do a point of care testing today to check to see if you have chlamydia, gonorrhea,
And for the usual.
Yes. And we would treat you today. Okay. Now with the HIV, the hepatitis B and C, we would actually have to have you go to the lab to get that blood work done.
There's somewhere else.
We will wait for those results to come back. And also there is a medication, it's called PrEP, prophylactic prevention for exposure. And for men who have sex with men, you're more at risk for HIV, for the transmission of HIV. And if you're not positive for HIV, we could give you the medication daily, and you would just take that. You would just take it, and you would have to come back every 3 months, because we would have to check make sure that your kidneys are functioning okay.
Make sure I'm still good.
Yes, and we would have to repeat the testing for hepatitis, Hep C, HIV, and syphilis.
That's understandable, yeah.
Okay. So what we're gonna do, I'm gonna get the specimens, and then we'll send them out to the lab. At this time, do you have any questions or concerns or?
Yes, I have a few actually.
Sure.
Because you're saying PrEP is to prepare to not have HIV, would I have to? Yeah, thank you. Let's say if I didn't have it, would I still have to take that forever, or on occasion until?
You could take it until you would decide that you would no longer be at risk. If you would have any complication or side effects, then we would have to reconsider another.
Another question is, if I stopped having sex, like if I stopped having sex with men, would I still have to take PrEP if I'm not sexually active, or would I still want to take that just in case to make sure nothing's wrong?
Yeah, if you're not, now do you if you're not in a monogamous relationship, you can take it. If you feel like you're not at risk, if you're not having sex, you could stop, and then you can always restart.
Okay, that's good to know. Another question I have is, if I did get HIV, would I take PrEP, or would I take a whole different thing?
No, you would take a combination of 2 antiviral medications. You would not take because you actually have the HIV, and actually it would the reason why you would be taking the medication is to decrease your viral, where it would be at an undetectable level, which means that you wouldn't be able to transmit the infection to your partner.
Of how far it's gone? Okay, that makes sense. Okay, that makes sense. One last question. Thank you so much.
Sure.
Because I was nervous about that question about HIV. So thank you. One last thing. How much would this cost if I had to take PrEP and/or medication for HIV? Like, how much would this cost me, or is this?
Do you currently have insurance?
Yes, I do.
Okay. Most insurance plans will cover it. You may have to get an authorization, but it would be covered. And for individuals who get your resources out there with medication.
Okay, and that would cover the other tests too, for like gonorrhea, chlamydia, the usual stuff as well.
Yes, it would. It would send the lab work out. Now, that would be an additional charge under your lab.
Okay. I'm getting tested for that today, and the HIV will take another time or two, correct? Okay. All right, that's good to know. One last question. Sounds embarrassing, but I have to ask. If I do get this virus, what do I say to people that I know? Like, if I get this, what would I do? I don't feel comfortable discussing this if I did have it.
Well, there is an organization that's called the Ryan White organization, where actually they will first of all, they will help you to be able to deliver the information to your family. And also, I think they would also make arrangements to even be there. And also, too, would give you the opportunity to talk to other individuals who have HIV. So you can see how they were able to, progress through life with their journey.
Okay, that makes sense. I would appreciate that, yeah, because I've never talked to my family about this. They don't even know I'm involved with men right now. I haven't caught them up since my relationship with my girlfriend.
Okay.
That's good.
Yeah, and that would be supported, just so that you have that support that you can.
That makes sense. All right, yeah, that's the last question I had. Thank you again for making me feel okay with that, and I feel good.
Okay.
Nervous. I'd rather know than be left in the dark. So.
Yes, the more information that we know, the better we can deal with things and live our lives.
All right, then let's do this. I'm ready.
All right. Thank you.
Thank you so much.
So looking at Brandon, there was a lot going on. I think first and foremost, always remember, if he's symptomatic for an STI, let's treat it. There's no reason to be withholding treatment for somebody who's symptomatic for an STI. I think the other thing that went well in this scenario is that we didn't really get hung up about disclosure of certain sexual activities. We really prioritized the testing and the care of the patient. And that should be true in real life as well. We don't need to make disclosure to us a prerequisite for people getting the care that they need. And then, Brandon did have this great question, how long do I have to be on this? And is it forever? And I think it's always good to remember PrEP is not forever. PrEP is for periods and times when people are at high risk or heightened risk, and that may extend for a long time for some people, and it may be a short time for other people. So really being thoughtful about that. And then I think the key thing to remember with Brandon is because he's a man who has sex with men, he actually has two options for PrEP. It's not just simply tenofovir disoproxil fumarate and emtricitabine. It's also tenofovir alafenamide and emtricitabine. He could go with either or. And I think that is something that's unique because Brandon is a man who has sex with men. If Brandon was, a young woman, we would really just be looking at the TDF FTC version of PrEP because that is the one that is approved for all comers. So all people could receive tenofovir disoproxil fumarate and emtricitabine, but only men who have sex with men and trans women can really be using tenofovir alafenamide and emtricitabine for protection with PrEP. So now let's hear what Brandon thought about the interaction and what he thought was really important or was something that maybe could have been improved.
Thank you. I want to say thank you, Deborah, for participating today. You did awesome. You're awesome, just so you know. I wanted to ask you, how did you think the session went? How did it go for you?
Well, you know what? It's challenging because it went well for me because it really shows me the areas where I just need to kind of hone my skills and just become more comfortable with talking with people about their sexual history, and also that I need to really hone in on what the medications are. So
yes,
I think it's a good challenge for me. I mean, I was nervous. I was nervous talking with you, but
I didn't know that.
I appreciate it. Yes. And get the positive feedback too, actually.
I completely agree with you. You were the best I loved when you kept asking me permission to segue into the next part for patient care for me, because that made me feel much more comfortable, especially with how uncomfortable I am talking about my sexual history that I don't even talk to with my family or many friends. You created a very safe space when you kept asking permission to proceed with how you would present this task to me and testing, but also you made sure I understood from a patient that doesn't understand doctor terminology to make sure I understood what the next process would be for me. So that reassured me and validated my point to speak my truth to you. And I think that was really awesome. You're awesome.
Thank you.
So I appreciated that. Next question I have is regarding communication. What do you think went well in our encounter today?
I think that I felt like I connected with you. And there were some, I felt like you were, at first, I felt like you were anxious. And then I felt like as we talked, you were less anxious. And
I agree.
I felt like, and it's important to me. I felt like, and if I'm wrong, I felt like I was being non-judgmental. Just sometimes, I mean, in the clinic, especially if you're when you're younger people, as an older clinician, sometimes I'm very conscious that I don't want to like come off like,
Come on.
you know, yes, like, oh, like,
Yeah.
you know, being self-judged. And that's important to me. And I felt like that occurred. I don't know. Did you feel that? Or
I totally agree. As a person
okay.
who's very sensitive about anything in a personal matter for me, I'm a very private person in general.
Okay.
You made it very non-judgmental space for me to speak out. And I felt like with every time you asked permission, I felt like you weren't judging me because you would have just insinuated and kept going, but you literally were I felt no judgment on my part at all. I felt like you really took your time with each part and to make sure I understood your process, because there are moments you paused, but it wasn't like I wasn't there with you. It was kind of like you wanted to make sure I understood what you were telling me, informing me with. So I appreciated you taking your time with each part in each segment of the encounter. So no, I felt no judgment at all. Because if I did feel judged, I wouldn't have said anything or that much about my sexual thing if I did. So like you said, I kept opening up because I felt safe to say anything because you made it very non-judgmental, safe space. So yeah, I agree.
Thank you.
One other question. Regarding communication, do you think there's anything you would have done differently, or do you think something you struggle with you'd like to address, or do you
as far as the communication, really knowing the medications and really being real specific on like what could be, you know, the availability, the medications out there, like, you know, the dosage, the regimen, that kind of thing. And also, I think I want to be more clear on what the treatment plan is. It's like, you know, and for me, that would be learning the script, but actually putting it in.
Agree.
Just need to tighten it up a little bit.
Yeah, literally, I felt you were very thorough, and the only thing I felt uneasy about at all was just what medication I would take if I had HIV. Everything else was perfectly fine. I was just like, that's the only thing I was kind of like, okay, I have 2 medications, but I don't know, but I'm gonna take it if I got it. But you stated that I didn't even know there were 2 medications, so that kind of helped me as well. But that's the only thing I would say. Just what would those medications be? But that can be proceeded after I get my test results, so that's not even really as important in that moment. But I think you stated that enough for me to feel good. But aside from that, everything was extremely thorough on your part. And that's the only.
Let's take a look at a patient case scenario with Willow Diamond. She's a trans woman who's coming to the clinic today because she's run out of her antiretroviral HIV medication. She wants to restart her treatment as soon as possible because her partner is actually coming back into her new city to visit with her. Let's see how one of your colleagues handles this interaction and how she is able to get the medications for this patient.
Hi.
Hi, Willow. My name is Jamila. How are you today?
I'm good, doing really well.
Good. So I understand that you've been out of your HIV medication. How long have you been taking HIV medication?
I've been taking it now for about 3 years.
All right. And how long have you been out of it?
I've been out of it for 3 months.
3 months. Okay. Have you been having any symptoms or anything that concerns you that you may have been exposed to HIV in the meantime?
No, no symptoms. I haven't been exposed. I'm not sexually active right now, but my partner is coming down to visit me at the end of the month. So I just really want to get the medication to make sure that, you know, my viral load is under control.
Okay. And you've been not sexually active for 3 months. The time you haven't been taking the medicine?
Yeah, I haven't been sexually active since I moved to Chicago from St. Louis. So it's been about 8 months.
Okay. So I think that maybe I'd like to go ahead and check your kidney function, make sure that everything is going well, and I'd be happy to get that for you.
Okay, great.
I don't know what else to say right now.
Well, what about, will you be able to prescribe me the medication that I'm out of?
Oh, what's the name of the medication?
I don't remember the name. It was like a little blue pill and a little yellow pill that I would take. I just can't remember the name.
Well, that's not a problem. I will be happy to go ahead and find out which one we should recommend and get that for you. Give me a moment to look that up.
Okay. And how long do you think it'll take for me to get undetectable again?
We need to check your, thank you for that question. We need to check your viral load and identify how much of the virus has how much is replicated, if it's grown. Because the lower the number is, of course, like you've already said, the less chance that you would have for passing that virus on to your partner. Is your partner positive or negative?
No, he's negative.
Okay, negative. Oh yeah, that part, I don't know how long it will take before your load will be undetectable.
Okay.
But I'll find out.
Okay. And do you think I will be able to have sex with my partner when he comes down? Because I'm in a serial discordant relationship, so I just want to.
Right. When is he going to be coming?
The end of the month, so like I guess like 3 weeks, three plus weeks. Yeah.
That is a super good question. Yeah, that's a very good question. I'm going to have to find out some information so I can give you the correct answers.
Okay. Okay. And then I also wanted to know if you know of any other physicians that treat trans people, because I would love to be able to get my hormones and my HIV medication from the same doctor.
That is a great idea. I actually do. I know that Ryan is a resource in the area, and so I can send you to them, and they're really going to be able to help. We'll call today, and we'll just see if we can get an appointment. They'll be able to they do deal with this all the time, and so they'll be able to give you up-to-date answers and provide that without having to look it up. Although I want to find it for you, they're going to have it right on the tip of their tongue.
Okay, great. Thanks so much.
So I really don't know what else to say. I'm sorry.
Okay. Well, I mean, those are my main concerns that I came in for today. So thank you.
You're welcome.
So that was a really great interaction. And I've got to say, one of the pieces about that interaction that I loved the most is, remember, she's just a person. Like all of your other patients, Willow is just a patient who's living with a chronic illness. One of the things that I would do is I would contact her previous provider or pharmacy to determine her old regimen. It is very common for patients to forget what medicines they're on or to not be able to pronounce the names of the medicines that they're on. And so I think really being able to pick up the phone and call our pharmacy colleagues and say, hey, can you just confirm which medicine this was for me? Can go a long way. Assess how Willow stopped. This is really, really vital in patients who stop their antiretroviral therapy. Did Willow stop cold turkey, or did she stop and start, or did she try and stretch her medicine by breaking pills in half or taking one every other day? When patients are really trying to stretch their medicine and not taking it appropriately, that's actually when we see the greatest risk for the development of genetic mutations, which would mean maybe her medicine's not going to work anymore. So long as Willow just ran out of her medicine and she just stopped taking it one day, then that means she's probably not going to have developed any genetic mutations, and she can just restart the same regimen she was on before. And that's something really important to know and to go over with the patient, that if you were ever to stop your medicine again, do a cold turkey. We don't want any problems down the line for you. Always have that warm handoff to a new provider. Willow is new in the city. She doesn't know how to navigate who is going to be friendly to me, who's going to know how to do my sort of gender affirming hormone therapy, and really trying to make those connections for Willow before she leaves the office can be really helpful. And then finally, condoms and or PrEP for Willow's partner, because you don't have a viral load. And we don't know if Willow has a detectable viral load. And we don't know if her antiretroviral therapy is going to reduce her viral load to an undetectable level fast enough so that when her partner comes, she would be able to have unprotected sex without any risk of transmission to her partner. And so in that case, what we recommend is really barrier protection method for Willow and her partner, and or pre-exposure prophylaxis for her partner while Willow's viral load becomes undetectable. Now let's see what Willow had to think about the interaction.
Jamila, why don't you start? Let me know how that went for you.
Well, it was felt so bad that I had no clue about a lot of this. I actually, I don't think I've ever cared for someone. I shouldn't say cared for. I haven't had an opportunity to treat someone who is transgender, and I didn't know how to integrate that into addressing antiretroviral therapy. And I thought, oh my gosh, she's coming to me for help and I don't know what to say. And I felt unprepared. And I immediately looked it up. So now I can answer you. It'll take 6 months. So no, you can't have sex right now. Sorry. But anyway, I felt really anxious because I didn't have an answer. And it's my goal to be able to be helpful. And so I felt really bad about that.
Okay. Well, listen, don't feel bad about anything, right? It's a learning platform. It's a safe place. But I can totally understand with what you're saying. And I think in times like that, it's okay to be honest. Like there were moments during our encounter where you said, I don't know, but I will find out, right? I will look that up for you. I'll get back to you. So you were being really honest about not knowing all the answers, and that's perfectly fine. I'd rather someone say to me, I'll get back to you with the correct answer than to just make something up, right? So I think that that's totally fine. So I would just continue to do that, right? If there's something that you're just not knowledgeable about or confused about, just let me know. Say, I don't really know about that, but I'll get someone that can help you with that, or I'll look that up and I'll get back to you. Because at least I know that you're working for me and you're gonna go, behind the scenes and find those answers for me. So I think that that's perfectly fine. But I do feel that you really were trying hard to make a connection with me, right? You were, even when you got stumped at that one point, you're like, I don't know where to go or what to ask. I feel like you were still with me. You were still present with me. You were listening to me. You were trying to understand my major concerns. You found out that my partner's coming down and you were concerned about making sure I got my medication and trying to find out the name of it. So I really feel like you were paying attention to me and you were, trying your best to really hear me out and find the best way to help me. So that definitely made me feel supported and made me feel heard as well. And then you mentioned that you haven't treated many trans people before and you didn't really know how to work that into this conversation, but I didn't feel that way. I didn't feel like you've never treated a lot of trans people, because I just felt like you were just talking to me like a person. And that's what's most important for me, is that you're acknowledging that I'm just a person and I'm here for medication. And that's what your main priority was to find out a way to get me that medication. So I really felt like our communication was good. I felt that we were, talking to one another. I was open with you. I felt comfortable talking to you. You didn't make me feel uncomfortable at all. And then even at the end, when I asked about a physician that can treat trans people, you right away gave me the name, right away told me, yes, I can definitely send you over to Ryan and he can definitely help you out. That's a great idea, right? You even told me that that's a good idea. So I really felt like I was being cared for and I was being treated appropriately in this session. So thinking back on our session together, were there any things that, maybe stood out to you that you had questions about, or were there any moments that you said to yourself, oh, I wish I could do that again or try that differently?
Yeah, when you said you stopped taking it 3 months ago, now I'm wondering, why did you stop taking it 3 months ago? And was it financial? Was there some other reason why you stopped? Side effects? I mean, what that was, and I didn't even ask about that.
Great. So you want to ask me now, and I could just tell you the reason
well,
why.
Sure. Why did you stop taking your medication 3 months ago?
So I actually ran out of the medicine. I moved to Chicago from St. Louis 8 months ago, and I just ran out of the prescription. And I called my previous doctor, and they told me that since I haven't been seen by them in 8 months, I would have to find a new physician out here to get the medication from. And I've just been so busy with work. I have a new job, and I've just been so busy and kind of stressed out that I've been neglecting my own health. So
Right.
That's why it's taken me so long to be seen.
Right. Then what I think I would like to do in that situation is call the doctor with you and see how soon you can get the appointment. And then if it's like right now, getting in is 3 months. It looks like it's a really long wait for a new patient. We'll just see how long it'll take, and then I try to provide the medication to cover you until that time.
Great. How'd that feel?
That felt better.
Good. Yeah, definitely. And like you found out more about me, and we had, a little more communication with each other. And that suggestion of making that phone call with my physician is so great, because I can't remember the name of the medication. So if you were to call with me, they would be able to tell you right away what that medication was. So I think that was a great way to do that. All right, so again, looking back on our session, reviewing what we talked about and what happened, are there any key takeaway points that you would take with you?
Well, you telling me to remember that I'm just a person. That totally takes any of the angst that I have about interacting with a condition or a population or whatever that I'm not familiar with. Just remember I'm dealing with a person that is here for whatever they're here for, and then address it and try to listen, make sure I'm listening to what the person in front of me is saying.
Great. Excellent. That's a great takeaway point. All right, well, I really appreciate your time. Thank you so much for working with me today.
Thank you, Willow. I appreciate your feedback too.
Now let's take a look at patient Alexcruz. He's coming back to clinic today after you give him a call. He was seen a few days ago for a sore throat. His rapid strep test was negative, but his pharyngeal culture has just come back positive for gonorrhea, and the HIV test you sent was positive as well. So in today's visit, Alex is going to have to learn about his HIV status and about his gonorrhea. And let's see how one of your colleagues sort of discloses this information and then what she chooses to do next in terms of treatment and care coordination.
Hi, Alex. How are you today?
Hi. I'm okay. I'm just a little worried and frustrated. I just don't know why you wanted to see me again. I came here 2 days ago for a sore throat, but I don't know what could be such a big deal.
Okay. And you had your rapid strep, which was negative.
Okay.
We did some testing. We did the pharyngeal swab. And the reason why we called you back is that you were positive for gonorrhea. And we can treat you today. We can give you medications today. And also, you're positive for HIV. And I know that sounds very scary.
Wait, what?
Yes, HIV.
I'm sorry. I was not. Am I gonna die? What's going on? I'm sorry. I don't understand what's going on.
It's understandable. HIV is treatable. It's a treatable condition. There's medications that we can prescribe for you that you can take on a daily basis, and you can live your normal, happy life. But with HIV, the importance of taking medication daily is to keep your viral load down, meaning that the lower your viral load is that the HIV is like inactive.
I'm sorry. I just need a minute. I'm not. Hold on. I'm sorry. I apologize. I was just not expecting this at all.
Take your time. Take your time.
I don't know how to ventilate. I missed what you just said. You said, am I gonna die or no?
You're not gonna die. You're not gonna die. Your conditions are treatable.
Okay.
There's medication that you can take every day that would help control your viral load. And with HIV, they look at your viral load. They want it to be low. When it's low, I'm not sure the actual numbers, but when it's low, it's like you don't have, it's not active, meaning that it's not producing the virus and you can't, it's not transmitted to your partner. but you have to take the medication for the rest of your life.
Oh my God. Rest of my life?
Yeah, yeah.
Oh my God. And where would I get this? Is my health insurance going to cover this, or how do I get these pills, or what pills? And
We'll put the when I order the medication, your with your prescription plan, if they don't cover it, there's programs that will help cover the medication that would defray the cost so that you would be able to take the medication.
okay, and do I take them once a day, or how many times a day do I have to take pills?
Well, most medication, it's once a day. You may have to take a combination of 2 medications, but it's usually once a day. It's pill form, and nobody would know but you. So it's not that you have to take injections. You don't have to go to the doctor. It's just that you have the medication that you have to take every day. Do you have anybody? Have you ever taken any medication on a daily basis? Like, do you have asthma or anybody in your?
I had asthma as a kid, but I had an inhaler. Yeah.
Inhaler. And you probably remember you had to take the inhaler to control your asthma symptoms.
Mm-hmm.
It's like somebody who would have high blood pressure. You just take the medication every day, and you'll live. You won't die. And there's some precautions that you want to take. You just want to it's okay. And there are millions of people living with HIV. Some people have had HIV over 30 years, and they are living healthy. They're living a full life.
Okay. Do I have to tell this to people? How do I tell people this?
Well, you certainly can share with your family, your support system, and also your partner.
Okay. Okay. Sorry. I do not.
It's a lot. It's a lot at first. It is. It's a lot at first.
Okay.
Now, what do you know about HIV? Do you know anybody with HIV or?
No, I don't know anyone.
Okay.
Or at least no one has ever told me they're HIV positive. What I've seen in the movies and in TV that a lot of people died in the 80s and 90s, and I don't want to die.
Well, back in the 80s and the 90s, we didn't know a lot about it, but we have come so far that you probably have had an encounter with people with HIV, and you don't know it because they're healthy.
Right.
They're healthy. They're taking the medication. And when you want to share that information, you're going to share that information with your support system. You're going to share that information with your partner.
And how do I tell them this? Like, is there steps, or I don't know. I need help with that. I wouldn't know how to tell people this.
You would just tell them. You would just say, I have something important to tell you. Have it where you're sitting, where you're comfortable.
Right.
And you would just tell them I'm HIV positive. And they probably may have a reaction, not so much that you have HIV. They probably will have a reaction that it may be devastating to them because they love you, and they may not know all the facts too. Because a lot of people assume you have HIV, you're going to die, and that is not true. That is not true. Not true.
Okay. So when could we? Oh, sorry, and there's gonorrhea too. I forgot. Yeah. How do we treat that?
We would give you an injection, a Rocephin, and that would be today. I can give that to you today. And
how long would it take it? Sorry, I didn't mean to interrupt, but how long would it take to go away after the injection?
You would want to abstain from sex for 7 days before you live. Now, because you have the HIV, you would want to, it's important that once we get you on the medication, you want to take your medication daily. And what have you used in the past to protect yourself from sexually transmitted infection? What have you used in the past? Condoms or?
I've worn condoms or used condoms before, but they're not my favorite, so I don't use them often. And now I learned my lesson, I guess.
When you said this not your favorite, is it that what's
I just don't like how they feel.
okay? You use the latex condoms?
Yeah, the over-the-counter ones. Yeah, I'm not sure.
And that would be important until we know what your viral load is that you would want to use to prevent transmission.
Yeah. Yeah. Oh, okay. Well, when could we start this medication or this treatment?
Well, we can start you on the medications today, which would be you would take it once a day. Wait, I'm sorry. Yeah, once a day. And we would also refer you over to a physician that would specialize in taking care of patients. And I do have a name for you. What community do you live? Do you live close? Or do
Yeah, I'm out here in Philly.
okay. There are many providers. I know 3 providers in this area, and they are all good. They all work in the same location.
Okay.
Dr. Green, Dr. Yellow, and Dr. Brown. And I can, if you like, we can call now to make that appointment.
Yeah. Okay. Yeah, we'll love that. After this, we can do that.
And basically, they'll just ask you some information like your date of birth. They want to know like your insurance, and then they're going to ask you what date would be preferable for you to come for your.
Okay.
Any other questions or any other questions or concerns or?
No, I think I'm okay for now, but thank you for your help. I really appreciate it.
Okay. And when you talk with your family, your partners, just, you think about what you want to say and just tell them. And do you have a support system? Who?
I don't really talk to my parents anymore.
Okay.
But I have my roommate. He's my best friend.
Okay.
I could talk to him.
And I'm just looking, are you in a monogamous relationship?
No.
Okay. You happen.
No, I'm not dating anyone, so yeah, when I go out and party, I do have sex with people.
Okay. And one thing too, and I don't want you to be alarmed, both conditions are reportable to the health.
Okay.
By law, and by law is reportable. And what that actually means is that they will probably contact you just to try to get some information of who you're contacting. I would advise, if you can, let your partners know. But if you have the name and address, they would just send them a letter saying that they were exposed, so that they could also see.
Oh, wow. Okay. Yeah. I'll think about if I can find their information.
Okay.
All right.
Are there any other questions or concerns?
No, I think that's it for today. Thank you so much.
Okay, so we're going to give you the injection today, and I'm going to send a prescription over for the Descovia. And if we'll work with the pharmacist. The pharmacist will be able to tell me if I need like an authorization. And if that is, we just give them the information that they know. But also, would you like to call the doctor's office where we can get you set up for a follow-up appointment today?
Yeah.
Okay, how about we do that, and then you already have that on your calendar. Okay. All right. Any other questions?
No, that's it.
Okay. And I just want to say, Alex, just take care of yourself. Don't be hard on yourself. Don't beat yourself up. It doesn't mean you're a bad person. You know what? Things happen, but this is very treatable. And I want you to remember that this is treatable. It's not a death sentence. It's not a death sentence at all.
Thank you.
And stay close to those people who support you and who love you.
Thank you so much.
Okay.
All right. Talk to you soon.
All right.
Whew, that was a doozy. So everybody take a deep breath. And remember that when we disclose HIV status to patients, take your time. There's no rush. Disclosure is a thing that is different for every single person. And really and truly, what I usually do is tell the patient and then just wait and take my cues from the patient. This is a really, really anxious time, not just for our patients, but for ourselves. And so it's important to remember that when you're sort of interacting with patients. The one thing that I will say that I think is really important after disclosure of an HIV diagnosis is to assess the patient for safety. We want to just make sure that this person is safe when they leave our clinic, that they're not having thoughts of hurting themselves or hurting someone else. And this is something that really should be done explicitly and then documented explicitly in your documentation in your note. Always, always remember, you've got to treat the STI. I know I sound like a broken record now, but one of the really important things here is that there's more than one thing going on with this patient, and we don't want to miss the STI because we got consumed by the anxiety that is delivering an HIV diagnosis. And then remember, if the patient is ready and interested, you want to start antiretroviral therapy as soon as possible. There's a lot of studies that are showing us and demonstrably showing us that early access to antiretroviral therapy is better for long-term outcomes. And so don't get hung up on which medicine we need to be prescribing, what's the genotype, what's the viral load, what's the CD4 count. DHHS, or the Department of Health and Human Services, has laid out two options when you don't have all that information. So there's either bictegravir, tenofovir alafenamide, and emtricitabine, or darunavir, cobicistat, emtricitabine, and tenofovir alafenamide. The medicine that has less drug interactions is bictegravir, tenofovir alafenamide, and emtricitabine. So that's the one that I would go with. But I really think either option for most of our patients or for Alex would be appropriate. And then, just as happened with your colleague, a warm handoff to a longitudinal provider. You want to know who are your HIV providers in your network and who is it that I can pick up the phone and call and say, hey, I have a new patient here and I'm really concerned and I want to get them in to see you quickly. Now let's see what Alex had to think about the whole interaction that he just sort of went through and figure out, are there places that we could improve or things that maybe went really, really well and Alex really appreciated?
Yeah. First of all, Deborah, thank you so much for jumping in and for volunteering. That went really well, I think. Before I give my two notes, how do you feel that went?
I felt good about being supportive, trying to relieve your concern about dying, and also when I was talking, because it was a follow-up, and I was thinking I should really ask you about your sexual health, and that's why I didn't go in it. And you know what? Now that I look back, even if I had known your sexual health, I could have still reviewed it. Yeah. But and with the training, I need to review like the medication and so that I'm better prepared.
Yeah. Yeah, no, I thought you handled it really well. I feel the empathy. I feel at home for some reason. It's a word that kept coming to my mind. I loved how motherly you were by delivering these news and how you kept, reminded me that this wasn't a death sentence and that there was treatments and that it wasn't like back in the days how people were, dying so quickly from HIV. I just thought, as a patient, that the news were delivered a little too quick. It was like we were just talking and then boom, the results came back and my whole world fell apart too quick.
Yeah. Okay.
There's never an exact time when to deliver the news, but maybe I would have followed up a little on how the symptoms of the sore throat were continuing from the last visit. I would have checked on, so how are you feeling? Have you gotten any better before so I feel more at ease in the doctor's office at that point. But I loved how when I asked you, how do I tell people this? You said something along the lines towards the end, something along the lines of, this doesn't mean you're a bad person, you're a good man. it could happen to anyone. You probably have met a lot of people with HIV and you just don't know it because they're so healthy these days, right? And that put a lot of things in perspective, right? Because I'm in such a shock that I wouldn't know how people are going to react to me, right? Am I going to be discriminated? Am I going to have backlash from my family? So that put me at ease, and I appreciate that. We also like to use something called a warning shot, and it's basically when you have this negative news that you're about to deliver, just like walking me towards that point before you say them. So something along the lines of, oh, we got the test back, they're not looking good, some things are not looking well. That way my brain is already preparing for the bad news, right? Instead of have the results back, you have HIV. It's like, whoa.
Yes. Yeah.
So that would be a good thing to use for the future. Hopefully, we don't have to deliver this news very often, I hope. But other than that, Deborah, I appreciate your help and being there for me. I felt it. Thank you so much.
Thank you. I appreciate you being a patient. Thank you, Alex.
Yeah.
And now let's take a look at Mariah. Mariah Brignal is a young woman who's walking into the clinic today for confirmation of an at-home pregnancy test. Let's see how one of your colleagues handles this interaction with Mariah.
Hey, Mariah, how are you today?
I'm okay.
Okay, so my name is Asha. I'm a nurse practitioner. I understand that you had a positive pregnancy test at home. Is that correct?
Yeah, that's correct.
Okay. So what brings you in today?
Well, I'm just trying to figure out if those pregnancy tests that I took was right, and just what should I do if I am pregnant.
Okay. So when did you take the test?
Last night.
And did you only take one?
No, I took 3. They were all positive.
Okay. And then do you know when your last menstrual cycle was?
Yeah, it was about 5 weeks ago.
And then, so about 5 weeks ago, you would say that you had unprotected sex. Is that correct?
Yes.
Okay. And you're not on any birth control or anything like that?
No.
Okay. And how many partners would you say you have?
I have 2.
Okay. And then were you sexually active with both of those partners in the last 5 weeks?
Yes.
And then do you know the, I guess, sexual health of those partners? Have you had like any discharge or any abdominal pain or any pain with urination?
No, I feel fine. It's just that my period is late.
Okay. So what we can do for you today is we could do another pregnancy test, which if you took 3 already and they all 3 are positive, more than likely it's also going to be positive. We can also do blood testing as well to find your HCG count and kind of predict how far along you may be. I know you said you feel like you're about 5 weeks. We can also, it might be a little too soon if you're only 5 weeks to do an ultrasound just yet, but we can also send you to a OBGYN if you don't have someone that you already see. Do you have an OBGYN at the moment?
No, I don't.
Okay, okay. Well, we can get you in contact with someone if you'd like. If that's something that you want to do.
I don't know what to do, to be honest.
How are you feeling about possibly being pregnant?
Stressed out, scared. I mean, like, I want kids, but I don't know if I want them right now.
Okay. So I can definitely give you some information as far as pregnancy and what things to expect. I can also give you some information on if you decide that you are not comfortable or you would not like to continue on with the pregnancy. But those things would honestly be up to you. I'm not gonna try to sway you in any way. Like I said, there are options and things available to help you make a decision. Okay.
Okay.
What questions can I answer for you?
Um, I don't know. I guess did you think I should be tested for STDs too or something?
That's definitely an option as well. So we do offer STI testing as well as some of the other common tests for HIV or anything else that you would like to be tested for. Normally, those tests are pretty simple. STI testing can be through urine or swabbing. We can also do an HIV test. Some of them have a pretty quick turnaround time. Some of them take a little longer. Um, if you like to, we can go ahead and get you started on those things. If any of them come back positive as far as the STI, there are medications that we can use, which we would have to be safe as far as if you are pregnant, so that we don't affect the baby. Same goes for the HIV testing. And if you were to come up positive, or if you'd like, there's medication that we can give you to kind of prevent you from developing HIV.
Okay. All right.
Do you have insurance?
I think so, like through my parents' insurance. I'm under theirs.
Okay. So a lot of the things that we would do today, if you were willing to do those things, are covered under insurance. So that shouldn't be something that you'd have to worry about. I also would like to tell you that if any of those things come back positive as far as the STI or HIV, I think you should also talk to your partners as well and have them tested as well.
Okay.
Okay. What else can I answer for you?
That's it, I guess.
And are you having any symptoms of anything?
No, I feel fine.
Okay. What else can I answer for you?
That's it.
Okay, well, we'll get some things started.
Okay, thank you.
You're welcome.
Thanks so much for that great interaction. Mariah is a woman that I think we frequently see in some of these convenient care clinics. And just remember, pregnancy is a risk factor for STIs and HIV. It means unprotected sex probably happened, right? And so really we should be screening all of our sexually active individuals for STIs and for HIV. And when you do that sexual health screening, really go through the 5 Ps. You know, maybe Mariah has a history of chlamydia or gonorrhea that we don't know about, right? And that would be really important to know in terms of her risk for recurrent STI or in terms of really thinking about pre-exposure prophylaxis. For young people, particularly in the highest risk age group of 25 to 34, think of PrEP as a rule out. Don't think of all the reasons why you can't do PrEP. Think of all the reasons why you should, and then have the patient really say to you why I don't need it. I'm monogamous. I'm not having any sex right now. I'm only having oral sex. Whatever it might be, that the patient can really make the case that I don't need that medicine right now. Otherwise, especially in high seroprevalence areas, like where Mariah lives, it may be important to offer the medication to her and let her make the decision about her own health and her own preventative health care. And now let's hear what Mariah had to think about that interaction and how it went overall.
Well, actually, I'd like to turn it around to Asha and get her ideas and thoughts. So how did that go for you, Asha?
I think it went well. I will say I was a little nervous about you saying that you hope it's not your first child, or, I mean, you didn't seem very happy to be pregnant. And I will say I haven't dealt with anyone that was like, it didn't seem that they wanted their baby or wanted to be pregnant. Other than that, I felt like it went okay.
Yeah, I mean, I agree. I felt like you came across in a very non-judgmental manner. You definitely answered all my questions, and I definitely felt heard and listened to and understood. So I really appreciated that.
Thank you.
What is something that you feel could have gone differently, or perhaps something that you struggled with during the encounter?
I think just initially figuring out the reason for your visit. Um, as a former ER nurse, we would have a lot of people come in and say, hey, I've had a positive pregnancy test. And it was mostly like, oh, it was positive, but I don't believe it's positive. So can you do another test? Was a lot of the reasoning why they would come. So just trying to figure out what was your reasoning for coming to the clinic, I think was one thing that I was like, okay, let's ask a few more questions so we can figure out why are you here. I was mostly trying to make sure that there was no like other concerns, like you weren't like nausea, vomiting, in bleeding or spotting or anything like that, just to make sure I wasn't really missing anything as far as why you'd come.
Understood. One thing that stood out to me just as the patient was, even though you did answer all my questions and you did give me the room to speak and ask me in an open-ended way, I noticed that there wasn't really much of a discussion to my emotional state, such as you look concerned, or I understand this could be scary. This is how we can help you. Just things along those lines, just to build a better rapport and understanding with me just as a person, and just not a person on your list that you're seeing today.
I do agree with that. I can see it in your face. Like I said, I felt that you were kind of unhappy about being pregnant, but I was like, I don't know if I should say anything about that, or maybe that's just how she looks, but hopefully not.
Understood. Is there anything, since we still have a little bit of time, is there anything in particular that stood out to you that you wanted my feedback on?
I don't really think so. Is there anything else that you could share with me?
Nope, nothing else from me.
Okay.
So thank you, everybody, for spending time with myself and your colleagues today, really looking at these patient scenarios and ways to implement the information in our previous sessions about PrEP and HIV starts into your actual practice so that you can start to really improve outcomes for these high risk and vulnerable people. Thanks so much.